Hello, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today, I would like to share with you, our followers and patients, the case of the patient who underwent a hair transplantation surgery in our clinic 14 months ago. This is the case of 32-year-old white male. The patient had a Norwood type 4 to Norwood type 5 of the hair loss. The first thing we always do when we have the patients coming for the hair transplantation surgery, that's the key diagnostic factor, is that what's the level of the hair loss the patient has. And we use the Norwood Hamilton scale for this purpose. On Norwood Hamilton scale, the hair loss in men is staged basically starting from level 2 going up to the level 7. High is the level of the hair loss the patient has according to the scale. High is the need for the grafts we need to get. That's number one. Number two, high is the chance that some patients, especially with the progressive type of the hair loss, may require more than one surgery to get the best possible result. So, as mentioned earlier, the patient had a Norwood type 4 to Norwood type 5 of the hair loss, meaning the loss of the continuity of the front hairline, thinning and the hair loss in the right and the left temples, front line, front third, in the mid scalp, and some thinning and hair loss in the crown area. So for this type of patients with the Norwood type 4 to Norwood type 5 of the hair loss, on average we may require the numbers varying between 4 to 5,000 grafts. Of course, numbers change from patient to patient depending on the size of the open area, the density you want to get, expectations, but the key factor here is always the capacity of the donor area or its ability to give a sufficient number of the grafts to meet the patient's expectations. The patient was planned to, the top priority for the patient was the reconstruction of the front hairline, covering the front area and the front third area. That was his biggest concern. And depending on the number of the grafts, we decide to improve overall density, especially in the mid and the crown areas as much as possible. So one of the key features here is that when the patients with this type of the hair loss arrive, I try to explain them, first of all, that the hairline should be conservative and simple, meaning that it should sit as high as possible, corners slightly elevated. So we basically, technically speaking, narrow the space and be able to give the patient more coverage and density per single surgery. That's number one. Number two, it looks much more natural and mature even over the years. The second point is that after the surgery, I always advise the patients to stick up with the medical treatment. Like it can be finasteride, it can be minoxidil, it can be like supplementary treatment with the PRP, mesotherapy, or exosome. So there can be different combinations of the treatments that can be set up individual for each patient. The main idea here is because when we do the surgery, it's like playing with the puzzle. It's like a key and a lock model. We have the hair loss, and with the surgery, we fit it in. But if over the time our non-transplant hair, pre-existing hair continue to fall out, we end up with new empty spots between them. So technically speaking, the surgery is always needed to cover the areas where the hair loss has occurred, and unfortunately there will be no regrowth, and we try to cover it as much as possible. And the medical treatment is the key to protect the hair that we still have, avoiding furthermore loss or at least slowing down as much as possible, so the effects of the hair transplant surgery stay for as long as possible. The main priority was the front area, and whatever is left, improve overall density in the mid and the crown areas. The patient was explained that if all the time the hair loss continues, or if he wants more density in the coverage, especially in the mid and the crown areas, he may require the second surgery, but it's always on demand. So the patient was extracted 4,050 grafts. Out of this number, 2,900 grafts were transplanted into the front hairline, right, left temples, and the front area. And the rest 600 grafts were implanted in the mid scalp to improve overall density in between the areas where the hair loss was most prominent. And the rest of this number, 550 grafts, were implanted into the crown area. So all in all, 4,050 grafts were implanted. And here we can see the result of the patient exactly 12 months after the surgery. Our key approach and key priority was the front line, and you can see the front hairline looks natural, mature, with some thinning starting at the front side, and as it goes to the back, overall density increases. The hairline looks solid, it doesn't look unnatural, and doesn't look that it never belonged this patient. And one of the key features here is the transition of these corners, or we call it the frontotemporal angle, when this front line makes a transition to this corner, and you can see how smooth it is done. That's why we always tell the patients that we need to keep this corner of frontotemporal angle higher, so it looks much more natural, transition becomes smooth. And if even all the time the patient continues to recede some more hair to the back, we won't end up like with an island of the hair here and empty spot to the back of it as well, because the hair transplantation surgery hairline is not only for today. This is going to stay with you for the rest of your life, and it should keep its actuality for as long as possible. So the result of the patient is really nice, a natural hairline, a smooth transition on the right and left temple corners. The patient is happy, we are happy, and the patient is very satisfied. There is some thinning still that can be visible in the crown area for this patient, but as mentioned earlier, the main reason for the surgery is to improve overall depth, and if you needed second touch-up surgeries every once in a while, may be needed. The key question, the main question we most of the time get from our patients is that, okay, if the patient or we decide to go on with the second surgery, where are you going to get the hair for the second surgery itself? We again explain them, we get it from the back of the head or from the donor area. And the second logic question we get from our patient is that, okay, if you get it from the donor area, and why you don't do it in a single surgery? Because here's the point, we can get the grafts from the specific area only in the donor area. It's called the safe donor zone. So because the outside of this area, the grafts are more prone to falling out all the time. So even though we get them, there is a high risk they will fall out all the time. So it's kind of gambling for the patient. Even though if the patient stick up with the medical treatment of finasteride minoxidil, this receding or shedding can still continue. That's number one. So we tell the patients, let it be a lower number, but solid number. Number two, if you do an aggressive extraction from the donor area, it can cause a more scar formation in the back of the head. That's also a problem for us, and aesthetically it may not look natural. So these are the main concerns. That's why we want to keep the specific ratio of the grafts we can get from the donor area, so the patient, when rebuilding the confidence, we don't want to devastate the donor area as well. The patient is happy, we are happy. One more successful result. If you want to get more information about the hair transplantation surgery, please leave the comments underneath the video. Our teams will get in contact with you, and we'll be more than happy to help you and guide you to today's life-changing procedure. Thanks for watching, stay tuned, and good luck.